Well, many people have leg veins, spider veins, varicose veins. We actually do not treat true varicose veins, the big ropey kind. Those we send to a vascular surgeon to treat. But we treat the spider veins, the small ones that look like kind of road maps, and some people have a couple of them and some people have both legs covered with them. The gold standard treatment is to inject a solution that essentially irritates the lining of the vessel, and then the vessel will close down upon itself and the body reabsorbs it. These vessels are not necessary for good leg function. We've got deeper vessels that are far more important, and so it's fine to destroy them, and that's what we're doing. A lot of people will ask me about laser treatment for spider veins of their legs. And a lot of people out there in the cosmetic world use lasers there. We have the lasers available. They are simply not as good. And the reason why many other practitioners do use them is that, frankly, it's quite technically difficult to inject these tiny little vessels, and many of the practitioners are simply unable to get good results doing that, and so they just go on to the easier to treat laser. But in fact, the best treatment results come from doing the injection sclerotherapy. Now, typically it takes about 4 treatments in any given area. But that may result in more treatments than 4 for any one person, because we can't, if someone's legs are covered, we can't do all areas each time. We use 6 syringes, 6 cc's of the fluid, up to that much each time. That's what is the acceptable amount to use. And so it's difficult to know for sure how many treatments a patient is going to need without evaluating them individually. But what happens is the area looks a little worse before it looks better. The purplish veins look purpler, sort of, and they look bright red. And so that's why we recommend that people do it in the fall and winter, rather than they start thinking about it in the spring or summer, but that's not the best time to have it done. You wear compression stockings for the 5 days following the procedure, and that just facilitates the veins clamping down upon themselves and eventually getting reabsorbed. There's no limit as to activity. As a matter of fact, activity is good, because anything, again, that constricts the blood vessels is good for it. And eventually they go away. Sometimes they leave little brown marks for a bit of time, but that will usually resolve as well over time. And it's a great treatment. We've been doing it for 20 years. It's very effective and it's very safe.